And when you talk about nephrology, a big part of that is kidney transplants. Has anything changed in regard to kidney transplants to make sure they're safer and those patients aren't getting hit with the virus when they're undergoing this operation?
Yeah. Well, first of all, we know that at the time of the real epicenter infections in New York and Chicago and Detroit and New Orleans and in several of the large centers, that at the time of very high infectivity, many of those transplant centers shut down doing new transplants in order not to jeopardize those patients at the time. Now, all of those have opened up again, and as far as I know, transplants really are back to normal in the US right now. But the concern remains all transplant patients who receive immunosuppressive medicines clearly are more susceptible to infection and to the complications of infection. And so the transplant community has been very wary and careful in following patients and in some cases reducing the doses of some of those medicines at times of stress or the times of infection. And at least so far, the data, the transplant community is collecting those data, but at least so far it does not appear that transplant patients were at higher risk than chronic kidney disease patients from this infection.
Okay. And now as we prepare for, I guess, a second wave, along with the regular seasonal flu, is there anything you'd suggest nephrologists do differently this year as opposed to past years in terms of screening and treating patients and general care for patients?
Yeah. Well, the first is that all nephrologists should be strongly encouraging all of our staff and patients to get immunized for influenza. The flu shot really needs to be mandatory among staff and highly encouraged among all patients. You know, the likely possibility of a concomitant infection, both from COVID-19 and from influenza is a really frightening thought. So number one thing we should be doing is being far more assertive about immunization for influenza. The second is no different than for everybody else, which is that we need to be strongly recommending face masks for anyone who is indoors with other people who are not part of their family bubble. Even outdoors, if there's no way to do social distancing, it really needs to be our new way of life. So face masking, social distancing, and then hand hygiene, those three things which we've all heard about for the last 7 months, for our patients, is really the critical barrier between them and infection.